Welcome to Chennai Press News Channel.
Gleneagles Hospital Chennai, a part of the Fortis Healthcare Network, has successfully performed India's first adult lung transplant using lungs from a pediatric donor, offering a new lease of life to a 39-year-old woman from West Bengal, suffering from advanced rheumatoid arthritis-associated interstitial lung disease. The surgical procedure was led by Dr. Govini Balasubramani, Director, Heart and Lung Transplant, and supported by Drs. Sindhura Koganti, Bimi Varghese, and Sushmita Roy Chowdhury. Following the successful transplant, the patient made a remarkable recovery and was discharged within 12 days. She is now able to walk independently and no longer requires oxygen support.
Good morning, I am Dr. Govini Balasubramaniam, head of the Department of Heart and Lung Transplant, Gleneagles Hospital Fortis Network. So we have done recently a successful pediatric donor to the adult patient recipient. So normally we choose a adult to adult lungs, but choosing a pediatric to the adult is little challenging. Similarly, adult to the pediatric it is not possible. So in the first time we have done this pediatric to the adult lung transplant successfully, and she got discharged on the second week itself. That is one of the fastest recovery I can say. Normally even a regular cardiac surgery, it takes almost 1 weeks to 10 days. In our case, being such a big surgery, she could able to get discharged within 12 days. And the importance of this case is because considering her height, she was been waiting for a longer period of time, and we could not able to get a suitable lung for a longer period. Almost she has waited for 4 to 6 months actually in Chennai. So recently we got a call from Coimbatore where there is a 13-year-old donor. So even though the size of the donor is smaller, but the lung which matches, we call it as a predicted total lung capacity, we calculate, and it is almost near matching. So we have decided to go and get this lung because we had done all the assessment on donor part which was looking good, and then we had taken this lung and then we implanted her. There are certain surgical challenges which we faced intraoperatively because the matching the adult vascular vessels as well as the bronchus is really challenging. So we have applied a certain special technique in her and we had a good outcome. So this is the first time we have done this, and probably even in India also. And in fact, even in the Western countries, they do very minimal numbers, because I can say less than 0.2% what they do it. The reason why we are highlighting this case is, even there is a pediatric donor, we cannot decline that. We can use it for someone who was in need of it actually. We get a lot of donors nowadays, and probably we have to utilize almost all the organs. So that is our motto. So considering this, we have went and this first successful pediatric donor to the adult patient. Thank you.
So you said it is India's first time. On what heading it is India's first time?
Pediatric, because it is a 13-year-old donor. So normally what we'll do is adult to adult, regularly that we do it. But pediatric to the adult is a little challenging one. Not many people who have been expertise in doing it actually as such.
Post-operative what we do?
See, she had a very good recovery. Post-operatively, normally we face some challenges actually. So normally when we could not able to get a pediatric donor, we do the lobar donor. That means we take out only the lower lobe of both the donors and then we implant. We have done that also in the same hospital. But there we will face some challenges, like we have to match that volume of the lung, because every adult needs certain volumes. So whether this is going to support her or not, we don't know actually, but we do certain specific test actually, and then we match it. If it is falls between 0.8 to 1.2, then probably we'll go ahead and do it. So in our case, it was falling around 0.8. So we did this transplant. Organ donation system in Tamil Nadu. I think Tamil Nadu is the one which has created this system actually. I really thank all the chief ministers who have taken the initiative, and also the present government doing the wonderful work actually. Whether the government, the chief minister changes, but the government does a good work actually. And in fact, every part of the state in this India, they follow the same system. They copy the same system and they are following it now. So that is a kind of work Transplant is doing now. I really thank Transplant, even though they work 24/7. Even though we sleep sometimes, but they are never sleeps actually, because they have to keep constantly the work on this process.